So I'll be talking on the basic concepts of Mann-Whitney U-test, research question which can be addressed using this test, underlying assumptions and hypothesis, what are the various commands for this test and how to enter the result in the table and how to write interpretation. And in the last, I will be summarizing So if I want to compare the mean value of an outcome X across two categories of a dichotomous variable, like if I want to compare the mean SGOT of alcoholic liver disease and non-alcoholic liver disease patients, what should I do? I may use this test because I have seen that the value of this outcome X is not normally distributed across the categories of a dichotomous variable. So I am confused that whether I should use independent sample t-test or because the hypothesis is that it should follow the normal distribution. But this is not following normal distribution. So what to do now? So many a times we already know that the variable of interest which we have included, it doesn't follow the normal distribution as reported by the previous studies also. So I have decided beforehand that I'll use Mann-Whitney U-test or I'll have to compare the median of these variable of interest across the categories of a nominal variable. So in both the cases, you should not worry because you have got an option of Mann-Whitney U-test, which is the non-parametric analog of independent sample t-test. So Mann-Whitney U-test is used when the assumptions of t-tests are not met. It is a non-parametric analog of independent sample t-test. It arranges the sample data in a rank order and then compare the mean rank of continuous variable across dichotomous variable. And by our previous knowledge, we know that dichotomous variable is a variable which has got two categories. What are the underlying research questions? So the first question could be, is the median SGOT level of population with alcoholic liver disease and non-alcoholic fatty liver disease are same? Is median post-operative pain as measured by the visual analog scale is similar for surgical technique 1 and surgical technique 2? And the third research question could be, is median Apgar score of babies born through normal vaginal delivery and cesarean section is same? So in all these research questions, what have you observed? So you have seen that there is a scale variable in each research question and you want to compare median of it across two categories of a nominal variable. So the appropriate statistical test for such research question is Mann-Whitney U-test, also known as Mann-Whitney test. Let's see the assumptions for Mann-Whitney U-test. So the first assumption is that the dependent variable should be measured either on ordinal or continuous scale. Example of these type of variable could be pain score, Likert scale measurements, BMI or any biochemical parameters. Second assumption is the independent variable should have only two categories. So it could be gender, where the gender is divided into male and female, and it could be two interventions also. The third assumption is that there should not be any relationship between the two groups or within each group, which we call as independence of observation. Like the case should not be a twins or a paired data, or there should not be husband in one group and wife in the other group, because that will violate the principle of independence of observation. The fourth assumption is the dependent variable should not be normally distributed across two categories of independent variable. and the distribution should follow the same shape. That means if it is skewed, then it both should be right skewed or both the distribution should be left skewed. So this is the QQ plot of the variable across the two categories of independent variable, and we can see that the individual data points, they are not along the diagonal line. That's why this QQ plot is showing that the distribution is not normal. Now let's understand the concept of distribution of same shape or of different shape. So if you focus on this first graph, whether you will see that it is the graph of the frequency of BMI of male and female, you can see the pattern is same in both the two categories. Like the pattern of male BMI and the pattern of female BMI is of same shape. It is in the same direction. That means the skewness is in the same direction. Whereas if you focus on this graph, it is very clear that the distribution of BMI in male and in female, that is not in the same direction. So they both are in opposite direction. So that we mean by the distribution of same shape in both the categories and distribution of different shape in both the categories. So what is the null hypothesis for Mann-Whitney test? So it says that the median of the two groups are equal, whereas the alternative hypothesis says that the median of the two groups are not equal. Let's learn the Mann-Whitney test in Jamovi. So open Jamovi. Click on this tab. Click open. Browse the data. This is my data sheet in Excel file format. I'll open this and this data will open in Jamovi. Now like we did for variable, we did the edit option. So similarly you have to change the variables. So I'm skipping all this. Like age you have to make as integer, continuous, then again gender, integer, then race again, nominal is okay but you have to make it integer. Similarly SES, I'm skipping this because my question is only related to this MI order. So this is nominal and this is integer. This I can write as a first attack and recurrent attack. Then click next. Systolic blood pressure, this is continuous. Diastolic blood pressure is also continuous. Total protein continuous. SGOT is continuous. LDH is again continuous. So this way we have added the variables and added their names. Now come to the analysis. This is the data. In analysis, first you have to check for the normality and the outlier. So for that, click on explore, go to descriptive. In descriptive, because you have to check this across the MI order. So the question which I have to test, that is this is the question that you want to study whether there is any difference in the mean SGOT and LDH level of patients who have the first order MI compared to who have the recurrent episode. And so I have to compare it across a categorical variable. These two are continuous. And MI1 is the first order and 2 is the recurrent order after checking for the underlying assumptions. So going back to the data sheet, I have to split it on the basis of categorical. So I will click this MI order and the variable which I have to take, that is the SGOT and the LDH. So shift these two variables in this box, variable box. Now there are two options, statistics and plot. So for normality and outlier, for normality we have learned that we plot QQ plot, and again there is a histogram also. And for plot outlier you have to click on the box plot. So click on this box plot You can click on this histogram and you can click on this QQ plot. And if you click on this statistics, I don't need mean, median I need. So median is there, and along with median, like with mean we call mean plus minus standard deviation. Similarly with median we express it in the form of the interquartile range. So I have unchecked this and I have clicked on interquartile range. Before you click this, you have to check first the QQ plot and normality, because how will we come to know that we have to apply the Mann-Whitney, not the independent sample t-test. So you just see the plot. So if you see these two plot, it is, you can see it is the right skew. Both are right skewed. It is not normally distributed. Similarly, if you see the box plot, there are many outliers in the SGOT. So these individual points, they are the outliers. So with these many numbers of outliers, it is expected that the independent sample t-test will not give the valid result. Therefore, Mann-Whitney U-test is the test of choice. Similarly, if you see the QQ plot, this QQ plot, the data point, this is not along this diagonal line. So this is again not normally distributed. Similar is there with the LDH. So this graph shows that this is not normally distributed. This QQ plot also, if you'll see, this is not normally distributed. So in the assumptions, we have seen that if the data is not normally distributed, and if the direction of the skew, you can see here that the mostly in this case also, the direction of skew is same. So in this case, we will use the median and interquartile range as a descriptive, and we will use the Mann-Whitney U-test to check for the hypothesis. So once you check this, then you click this interquartile range and median, because we need this as a descriptive. And then again you can go to this option of t-test. In this t-test, again you have to click this independent sample t-test, and here you can see that again this grouping variable will be the MI order, and this SGOT and LDH will be moved to this place. And instead of student t-test, now you have to check this Mann-Whitney U. You can see this option of Mann-Whitney U, and this when you check, then you will get that. And here you don't have to check for all this, because Mann-Whitney, these assumptions like homogeneity, normality, this we have checked. Normality and QQ plot we have checked with the descriptive option. So then you don't need this. You can say that SGOT and there is a difference. Descriptive you can see from this place. So if you go up and see the table, you can see here that the SGOT median interquartile range. So this is the median of SGOT in the first attack. This 59.5 is in the recurrent attack, along with this is the interquartile range. So this is the interquartile range of the for the SGOT first attack and recurrent attack. Similarly, the LDH value you can see here, and whether these values are significant or not, for that you have to go and see the Mann-Whitney U value. So statistics is this, and in first case this difference was significant, whereas in the LDH group it was not significant because p value is not less than 0.05. So this is how, when you have to enter this result in the table, then you have to enter the result like this. So this is the table. I have compared the median SGOT across MIA level. So this is the SGOT level, this is the median with IQR, and then this is the result of Mann-Whitney U test. So here you can see that this is the description, that the values of SGOT was not normally distributed across MI order as tested by the visual inspection of QQ plot, and there were a significant number of outliers which was kept in the analysis. Mann-Whitney U test was done to determine if there were difference in the SGOT level, and distribution of SGOT level for first and recurrent order MI was similar as assessed by the visual inspection of histogram, and then you have to report the descriptive. So this is how you write the interpretation.